Good evening, dear viewers, and welcome once again to your program Healthlink, brought to you here in the studios of QTV on Kairaba Avenue every Monday. Today we have the pleasure of having a very important guest, but before I introduce him to you, we will just start the program as usual by talking about the COVID situation. That still COVID is around. The numbers are less, but still we do record a few deaths, and some people are still actively suffering from COVID-19 in the centers, and still people are getting the disease. So we want to remind our viewers that the three things that we have always been talking about here are the same that we will continue to talk about, which is that people should avoid crowds as much as possible. But if there is no way that you can avoid being in a crowd, please try to protect yourself and protect other people by wearing a mask when you are in a place with other people, and also remember to wash your hands very frequently with water and soap, and if there is no water and soap, to use hand sanitizer. The other thing is that we have a lot of vaccine that the government has made lots of effort to put in the country here, and they are available in the country, but the uptake is still not as much as we would want it to be, because we want the majority of Gambians to be vaccinated, such that we are all protected and we can all go back to normal life without any fear of another wave coming back on. So please, if you have the opportunity to have the vaccine, take it. It is safe. As I always say, the people that we know in the Gambia have all taken it, and nothing has happened to anybody which is a bad complication, and people should know that it is safe and it is protective both for them and their loved ones. So please let us remember that. Mbokk yi ñu ngi leen a nuyuwaati fii nii ci Healthlink ci programme bi nga xam ne seen wér-gu-yaram nañ dee waxtaanee fii nii lundi bu nekk ci waxtu wi. Tey nag ñu am fi benn gan bu am solo, waaye balaañ la naa wax kan la ñu dugaate rek ci mbiri feebar bi nga xam ne ba tey mu ngi Gambia, xaw naa wàññeeku léegi nii, waaye ba tey mu ngi fi. So ba tey lu ñu daan wax rek la ñoo continuer di wax. Xam naa nag dina jafe ñu wax nit ne nañ bàyyi génn léegi nii all together, because affaire bi yàgg na te léegi xamatuñ kañ la moo jeex sax si biir àdduna si. So lu ñoo wax nit rek mooy nga moytul bu baax a baax pour di génn ci ay mbooloo, bem nekk loo xam ne farata la boo xam ne by force rek nga génn, nga door a génn. Soo demee ba di génn nga def ne yaa ngi sol sa masque pour nga aar sa boppa, nga aar ñeneen ñi nga xam ne ñoo nekk ci sa boor. Su loolu weesoo nga faral di raxas sa loxo time boo ko amee rek, ndox ak saabu nga raxas sa loxo. Ndox ak saabu moo gën, waaye soo amul ndox ak saabu yi ñuy ooyee sanitizer yomba na léegi nii, bëri na léegi nii, nga yore ko sa poos wala sa baag foo munti tollu rek. Soo laalee loo xam ne xam nga ne ñu bëri laal nañ ko, nga raxas sa loxo. Soo laalee xaalis nga xam ne ñu bëri ñoo laaloon xaalis boobu noonu, nga raxas sa loxo. Bépp soo demee foo xam ne di nga am ndox, nga raxas sa loxo ak ndox ak saabu. su loolu weesoo it tamit ñu fàttaleku ne ñàkk bi mu ngi fii nii, te ñàkk bi am na njëriñ ba pare nekkul loo xam ne day lore. ñëpp xam nañ loolu noonu ba nga xam ne ñëpp gisoon nañ bu mu njëkkee egsi si Gambie fii nii suñ président bi moo ko njëkk a jël, ministre jël na ko, ñeneen ak ñeneen jël nañ ko. Man mii dama dee wax ne man si ñu ko njëkk a jël si laa bokka. suma yaay mi nga xam ne mag la miig naa soo ne jël na ko, suma mbokk yu ma jege ñaale yëpp wax naa leen ñu jël ko, jël nañ ko. So nit yi nañ war a xam ne lii nii lu baax la si pour ñoom, nekkul loo xam ne daf leen a lor. ñu jël ko, ñu mun a aar seen bopp, aar ñeneen, parce que nu ñoo mun a aaree suñ bopp Gambia rek mooy ñun ñëpp ñu jël ko, wala ñu ëppa ci Gambia yëpp jël ko. Affaire bi nag mu ngi fi, free la, kenn duñ dee jël si moom xaalis pour def ko. So nga dem ci place yoo xam ne dañ koo def, nga def ko, nga aar sa bopp, foog naa ne moo gën. Dinaa bàyyi Kadijatu mu dugga ci mbir mi si suñ mbokki mandinka yi, den nag ñu ñëw ci programme bi wana leen ak suñ gan bi. Khadija.
Assalamu alaikum badingol balni mbaralan na jati kendi ya programme oto kamin sotale jang tene wo tenen QTV tele umbato alnal badi malam Kadijatu Diallo anen Dr. Abubakar Ba Dia. Badingol bidung ngaluntan ko mayarin dole fanan sotale jang bari jannim belunta ngonying folalie nse dungali na kachato bada badan katal hakilo bulandila kurango min na kola coronavirus kurango min benna nyin dunia kono jang adabe sate kono kal hakilo bulandi bada bada na tankarango min ya jabul HO ya fonye membe mararin dunia jata kende ara ko nyanta men kela wolom kam bulol ku wato wati nkarin na maksol dum wato wati adim fana ngaka foltala ni atara yalon ko ite tuno bari ya tala ka fonyinto akata yela maksudum ni yalon ko bulu kudu labe jamfari la be dawoda akata la sanitizer itare balo bala ye fengo fem ma yalon ko isobita ko mo jamal ya male walla bulo be nori ne e sanitizer nyinta e kama ibulo bala pengol nyim fanan dum be kerin ne adon abe man sakunda ya natinan ne apengo be siarin ne adum hani feng ita jola ebe min kala doron wolom ye fintinan yeta jata kende abunda to mi yalon ko be pengo nyen di kanne ite nyen kala fengo fenna ebe pengo nyen dilela ye fantanka ye sate o tanka ye badingol tanka mbe min kala don pour kanyen kurango bayna banko kan wolomo nga kata mbe ye finti nga pengo nyen ta mbe pengo nyen ta la nyamen mba kurango fanangana bayla wala nyama na sate mansake o ya tale adun jata kende abunda mul fanan be ya tale adun ninga lon ko nyim pengo nyim mambete ya ndol dum fanan tatala so pengo nyin nga yitan dalla ko ni ajen ka fale ko nyim mul be ya tale ka yitan dalla ko a pengo nyin a bete ya tale adun ate fengo feng kelalla na manke ka jata kende ya kafalma adun fanan kam fan tanka ngamba dingol tanka aninga banko mobi tanka. Thank you.
Thank you very much, Khadija, for that clear explanation. Ladies and gentlemen, as I said, I will not take any more time. The time is usually very short, and we have a lot of important things to talk about today with our guest. And I will waste no time but to introduce our guest, who is no other than Dr. John N. Jabang, who is currently the head of surgery in the teaching hospital of the Gambia, which is the Edward Francis Small Teaching Hospital. And he is a neurosurgeon by profession. Many people confuse him with me. They say they want to see a neuro, and then they come to me and I say, oh my God, I can't do anything for you. There's somebody else who can do it, and I send them to Dr. John Jabang, because urologist and neurologist or neurosurgeon, people confuse it. But they are two different things. Dr. John, we have explained to our viewers before that the rationale for this series that we are doing now, inviting doctors of different specialties to talk to our viewers, is that a lot of times our viewers do not know when they are sick that there is a solution for their problem. And a lot of people, especially in the village, will stay in the village or stay in their homes because they don't have any hope that if they go to hospital they can get treated. And on the other extreme, we have some people who have money and then decide that if they have any strange disease, they want to go abroad for treatment when the treatment is available in the Gambia. So we are educating our people on the different specialties in medicine, and we are really very honored to have you. And we really thank you. I know you are one of the busiest people around because of the demand on your profession, and because you are also heading a very big department in Banjul. For you to take your time to come to talk to our viewers, I think we will have nothing to say but a very, very big thank you for taking that time to come to the studios with us here. So I will not waste much time, Dr. Jabang. What really is neuro? When we say neurosurgery, what are we referring to? What are the type of diseases that we are talking about, so that our viewers will know, if I have such and such, maybe I need a neurosurgeon and I will need to see a neurosurgeon. I want to tell our viewers that our guest speaks both of the local languages that we speak on, and therefore he's going to make our job, me and Khadijat, very easy today. So whenever we ask a question, we will request that you answer first in English, then you can translate the answer in Wolof, so that we don't lose any, because if you leave it to us, we may lose some of the things that you say. So you can translate it in Wolof and then translate it for our Mandinka speakers. So this first question, which is, what is neurosurgery? Dr. Jabang, thank you.
Okay, thank you so much. I first of all want to begin by saying I am more honored to be here for, let me say, one very important reason. And the reason is that the very person that invited me to this program had been one of the people, and still continue to be, one of those people that have led me in my formative years. He taught me in medical school. He guided me through medicine. And today I am what I am, you know, and I am very, very indebted to you, Dr. Jah, and to all your colleagues who have taken all the time to teach us and to make us today who we are. So I can't be more proud, no matter how busy I am, whatsoever invitation you give me, be rest assured I will surely come.
Thank you.
Having said that, I want to specially greet you and the QTV staff and also our very esteemed audience. The question you ask, what is neurosurgery? So neurosurgery basically is a specialty of surgery. We do know that in medicine there are different specialties. There is what we call medical specialties, and there are also what we call the surgical specialties. And the surgical specialties have one thing in common, that is they perform operations, they perform surgeries. So when you talk about neurosurgery, it is that surgical specialty that is actually engaged in diseases of the nervous system. And when we say diseases of the nervous system, we divide them into basically two. There is what we call the central nervous system, which deals with the brain and the spinal cord, and there is also the peripheral nervous system, which obviously deals with the peripheral nerves. So a neurosurgeon, in a nutshell, it's a surgeon, a surgical specialty that actually deals with surgical diseases of the brain, the spinal cord, and the peripheral nerve. So in summary, this is what I would say would be a neurosurgeon.
Thank you so much, Dr. Jabang. You've made it so clear to our viewers, and the way you put it is really so clear that I want to actually stress it more, which is that you have said that there's the medical fields and the surgical fields, and in neurosurgery is that field of the brain, the spinal cord, and the peripheral nerves that the surgeons deal with. That's right. And there is another specialty which is called neurology, which is for the medical people, for those ones that can be treated medically. That's the same way with urology, we have a urologist and we have a nephrologist who deals with the kidney but do not perform operation. Thank you so much, Dr. Jabang, for that. But if we can just in summary say this to our local language speakers.
Okay, mbadi la mo lalbe momo konto na minke la mo na programme la bi ngako mo nyin commencer le ka fo Dr. Jah ko abaraka baki ka tu Dr. Jah atale moti yemi lon ko bi na karamolem bidin tolbe nun karan medical school itol len tol karandi fo bi nata ni mecho ta ngano woto ayen kumandi kuwo kuminna nda folay no hani atram busy sa nyaawonya ayon kumandi kuwo minna mba folay andum binala le pour ngana ngamuta nse banko be so hakilola kabo jata kendiato oto Dr. Jah inin imonyol mume yemul lon ko atolle mol karandi bilin tolbe medical school mba fola tole ala barka baki ay nyinin karo minke wolem nyinti tibab kamole ka fomiye neurosurgeon nata wole fatan fansa ka foko ni ajibe jaral dula bundato yo ala bundal siyatal yo doctoria ni akaran ni tata fo nyato mume ka bonan nim bunda jamal yo wo bundal to dum bunda fulale bi jemi lon koy kumayata bake folon ka fo mi ko physician ko lem doctoral ti mi lon koy tol be mu doctoral leti yo dol bi jele ka fo ko surgeon yo ni amoy surgeon itol lem doctoral ti mi lon koy tol kamol opérer yo wo surgeonol fanan kono isi fa siatal yo dol bi jele mi lon koy tol kamol le opérer mi problème mo sote konoto yo sa fo ko general surgeon o natra français kamole sa fo chirurgie digestive yemi lon ko atelem surgeon o yemi lon ka tel ko kono opérer yo dol bi jele ka singol nim bulol le opérer sa fo ko orthopédique so ndolla do ko namin karang ika fo le neurosurgery wo munati wolem wo docteur ti yemi lon ko ateka sa sal minu opérer wollem wo sa sati mun botnan kumoto anin kokulol to anin fasol to. So neurosurgeon o ite mari ika wolleke pour wax rek del ci waat si luñ doon wax fii sànq ci English waxaat ko ci soose dama doon gërëm docteur Dia parce que docteur Dia tey bokk na ci ñoo xam ne ñoom ñoo ñu formé ñun buñ doon def medical school jàpp nañu jàngal nañu loo xam ne tey duñ ko mën a fay te maa ngi koy wax ne jërëjëf parce que tey moom moo ma invité pour ma ñëw fii mun a waxtaan ak askan bi wax leen ci loo xam ne dafa am solo parce que wér-gu-yaram dafa am solo kon maa ngi koy dellu njugal parce que moom bokk na si ñoo xam ne tey ñoom ñoo tax ñun ñu nekk si place buñ nekk kon loolu laa doon wax rek sànq ne maa ngi koy gërëm di ko sant di gërëm ñëpp ñu nga xam ne tamit ñoo bokkoon ak ñoom di ñu jàngale ba tey ñu àgg place bu ñu àgg nii latte bu ma latte tey latte boo xam ne la moo nekk ne boo déggee ñu ne neurosurgeon mooy man lu ma doon lan mooy neurosurgeon léegi ci tontu bi lañ ko doon faram-fàccee di ko wax ne boo xoolee ci bunti wér-gu-yaram docteur am na façon waaw këri docteur am na façon te dañ bëri am na ñii ñu nga xam ne dañ dee opéré am na ñii ñu nga xam ne tamit duñ opéré léegi boo xoolee ci ñu nga xam ne tamit dañ dee opéré am na ñoo xam ne ñoom tànkay lañ dee opéré am na ñoo xam ne nag biir bi la ñooy opéré am na ñoo xam ne tamit yeneen place lañ dee opéré man lu ma jàng mooy pour ñu mun a opéré bépp feebar bu nga xam ne jar na opéré jógee ko si bopp bi dem si ndigi gannaaw gi wàcca ñëw si sidit yi loolu mooy neurosurgeon.
Jërëjëf Dr. Jabang, thank you so much for that clear answer in all the languages. Foog naa ne soo waxee boppa bi tam yaa ngi bugg a waxaale yuur bi.
waaw
nga xam ne moo nekk ci boppa bi. parce que loolu la ñëw dugga si léegi nii. so Dr. Jabang, I now want to know what is the scope, what are the things that we can identify with, because neurosurgery is really a very advanced field, and a lot of us may not even know what is dealing with. So we know it is deal with the brain, the spinal cord, the peripheral nerves, but can we give some examples of diseases that can happen that people can identify with and say, yes, if I have this, what I need is a neurosurgeon?
Yes, thank you so much. So the scope of neurosurgery is wide. Like I said, it deals with the head, it deals with the spine, and it also deals obviously with the nerves. Let's take it step by step. So let's deal with diseases of the head. And when we talk about diseases of the head, let's go back to childhood and we look at what are the common diseases of the head in children. They may be born with it, or they may have it when they are born, or they may have it as they are progressing in life. One of the very common diseases we see is what we call hydrocephalus. And when we say hydrocephalus, how do we recognize hydrocephalus? We recognize it in the sense that we keep seeing a child who is born, either first when pregnant, the doctors tell the parent that your child's head has grown so big that probably you may not be able to deliver normally or naturally, and you may need a cesarean section. Or a child is born and the child is fine, and all of a sudden the mother begins to see, or the family begins to see, that the head begins to increase in size abnormally, and that becomes very worrisome. And sometimes the child may even go, let's say he's got up to 3 months, she's able to have a head control, 6 months, she's able to sit on her own, and after some time the head starts getting big, then the child loses all those things. So this condition called hydrocephalus is a very common condition. And why would it form an important part of our discussion? Because as people are listening to us and watching us today, people will know that they have seen kids that have hydrocephalus. In those days, in our own part of the world, in Africa, there are so many misconceptions of hydrocephalus. So when these kids are born, people think, oh, they are born with gene. People think, oh, they are not the normal people. And there are different traditions. There are some traditions that send them back to the forest. They are like kids that belong to the gene. And of course, if we send them to the forest and go back, you wouldn't meet them.
Of course.
And you will say, oh, the genes have taken them. But of course, it's the
wolves and
the wolves and the hyenas. It's the wolves and the hyenas. Some people, depending on different societies, they will keep them in the house and nobody would know, and they will go through suffering and they would die. So it is a condition that is very common. Do we see it in the Gambia? Absolutely yes. Do we treat them? Absolutely yes. And if you treat them very early, it is very difficult for you to see that child from a distance and even know that this child has hydrocephalus. But if you don't treat them early, then they would come with a very big head. And the bigger the head, like Dr. Jamed mentioned, we are talking about the brain. The more water that is accumulating in that brain, then the less brain you have.
Tissue, yes.
And then it destroys the brain. And finally, you know, he would either be a child that has what we call delayed developmental milestones. He's not able to sit down. He's not able to talk when he should talk. He's not able to walk when he should walk. So, and it becomes a very, very big burden. So hydrocephalus is one of those top conditions, I think, that worth us mentioning and telling people its treatment is available in the Gambia.
Thank you very much, Dr. Jabang. Just like Dr. Jabang has said, it is now available. There was a time, I know, maybe 10, 20 years ago, when if somebody comes with hydrocephalus, you can only go abroad and have the initial treatment done. Now it is available in the Gambia, thanks to Dr. Jabang, who has gone to several places to learn his field. And that is why when he speaks Wolof, some of the people will realize that he has a bit of Senegalese Wolof in it, because he spent a lot of time in Senegal, and he also spent a lot of time in Israel, where he learned some of the latest ways of dealing with these things. Just in Wolof again, mbokk yi Dr. Jabang lu ma ko laajte léegi rek ci angale moo yoon wax nga ñu sa matière bi lan ngeen dee def, waaye si lu nit yi mun a xàmmee di ñu mun a wax yenn ci feebar yoo xam ne su xewee nit dina mun a ñaaw njortane lii nii feebar la boo xam ne neurosurgeon moo ko war a toppatoo, mu wax ñu ci loolu noonu. foog naa ne ñu bàyyi laajte boobu noonu tamit Khadija wax ko ci Mandinka, den mu ansal ñu loolu noonu ci Mandinka ak ci Wolof, mooy lan mooy feebar yoo xam ne ti dinañ ko mun a xàmmee ci feebar yi neurosurgery.
Mbaɗigol biɗum nga luntago min sotale jambi ka fo wole Dr. John Jabang docteur la ñinin karo ñimu minti wolom dindigol me ya lonko e ka taramol kono le e ka suute ko ñil jararol e sulata jararol le me ya lonko ñin neurosurgeon min surgery min e ba fokan abe kafuring fen kono me ya lonko asa a jaranole wolom hydrocephalus ñenti. So alaftaka wole fatam fansalye me ya lon ko ni ya tara ya dindingo je ikono isa lon ko amu fenneti me ya lon ko ase jaranole adum abe sate ko na banko kan janne.
Okay. Abarka bake Dr. Dia kulol bi jemil lon ko a fonitale do wandi. The last time ngani nin karo ken na pejo to kaya foye ko hydrocephalus ka fa nyaade man ka kangola o hydrocephalus nak lañ ko day waxe ci olof so fala tok ci page bi xam nga page bo xamne dafa tanga bo nek ni rek ku nek mu ngi pam way nak question bobu dama ko latte way I sat dama fa tok for a long time te deguma ken kuy wax ne ni ak ni lañ ko day waxe mbek mo mi fokan jang wolem ñinti ko sa mi lon ko kamin jara e ka fo mi ko hydrocephalus sa nyaadi lem mba tole jibe kan sa tofo man kan sa tofo sulwa kan la bare akoliyat wolem doron dindingo le min lonko i ka wulula ni wuluta jama asake ni wuluta i ka soto wadul ka soto fan timo nyin nakone ka soto kono nyin nakono e dol ka soto ni wuluta e dol ka soto dum afterwards i nata fo tamata fo tata nyaato demanding isna ya soto bare ka subute nyaadi le katu ni ko hydrocephalus e sa sale me bil lonko kum kemo nyin la jio wole problème o soto atata nata wolem hydrocephalus kumo kun kemo kano aka fan sun jiyo sotole o jiyo biti ata bakele puru ase kun kemo fango makoyno bare wati do jiyo nyin ala ta dulale kasuki nara ta dula sukita wo sati nane jiyo be kafukan bara ate funtilano kungo ñi yetara kawara yo kudol fanan bijele mi lonko minu fanan satin nano kungo ñi fanan ye wara bare aman jari kadum wo kacal ñun kono bi ñing ku sifa niaje wo kake dinngol la mi lonko jama ning ata dinngol la mi lonko ata le fay tamo commencer kungo ñi commence ta kabara do man dama baaje la ñin tamo ñi abina kol yala fe.
But, so while you're going on, I'll just ask our technical team to put the pictures. You got us some pictures of somebody who was treated for hydrocephalus. It was probably a mild one because we've seen much bigger ones.
That's right.
But you know, if we can have those first pictures on the screen while you're talking.
Okay.
Yes.
All right.
Yes.
So koy kany nyatalo min haynang tengi dinnugo nyi jemi lonko kungo nyi warata. Ha. Problem o nyi tata nata. Kun kengo nyin na jiyo wole problem o soto. Wole yatinna kungo nyin akawara. Nyim musasa doron neti. Amanke jinati. Amanke moko ten dolti. Amanke ko fenne ketela hani sa salem. Andum ase jara nole. Katu ni ma jara juna. Kuma kawara nyami jiyo ka kun kengo la palaso ta wole nyam. Andum hadama dum kun kengo leti. Mimman kunkengo soto aman fengo fenno kunkengo le satine ni mole hada mayano kunkengo le satine se wulno yetama kunkengo le katine se la kuwo kubek so ni wo kunkengo nyimbe dami jiyo ya la place o beta imari man ta fengo fennol woto nyimmu sa salti yemi lonko aka jarale andu ni a jara juna wo watole amari sala jata kende asotono bar ni a mutebul suwo kono ya bula suwo kono fo kunkengo jiyo nyim kunkengo la place o nyimmu meta hani ya mari opère aka kol ya bakele kat wo ka tarle ko kum ko nyin na place jamale be ti nyata ha woto mba folali ko ka fo sasam ko hydrocephalus e ni to sanol jibe amanke gambia dolon ti dula jama dol biye ni e soto e ka fo ko jina mollem nyinoti mbate safo ko a nyinde da fo ngolem nyinti isa samba ya bula bakono da fo ngole na ya dom safa ko butu ngamune faale kale ko da fengol nyinta fele nga samba wulo ko non tata je maaji wo yata da fengol ya dom so hydrocephalus amanke jina sasatin so fo molie moy mi lonko ye dingo soto ye mo soto mi lonka be bulu dinno yaaji ko kungo nyimbe abe warakan nanang ta loftanol ni tata loftanol to doctorol bafulo le nyanta min kela bayri a jaralo soto jang gambia jang itata dawo da ibe mari yoren nele pour ini mol señoje ibaje la nse mari offert ha luñu waxon fi ci sauce rek mo nek fever bu ñuy wax hydrocephalus nak nek na fever bo xamne dafa nek problème ndox bu nek ci yoor bi parce que yoor bu nek amna ndox waaw te sa yu nek ndox bobu dafa day nek di ñëwaat mu ees mu dem ñëwaat mu ees ñu dem léegi nag yeneen saay dañ dee gis ne ndox boobu noonu jaarukaay ndox bi dafa dee tëju jaarukaay ndox bi bu tëjee nag te léegi yow yaa ngay produire ndox te ndox bi amul fu mooy jaar loolu moo dee ta boppa bi di gën a rëy parce que ndox bi dafa dee indi pression si boppa bi te ndox bi bu indee pression si yóor bi boppa bi dafay gën a yaatu ci ay xale bu fekkee nag dafa dal mag nag boppa bi du yaatu déedéet parce que mag loolu dina fekk ne boppa bi tëju na already waaw waaye ci xale nag lu ñu feral di gis mooy boppa bi dafa dee gën a yaatu te yaatukaay boppa boobu noonu nag bu ñëwee bi am doole loolu moo dee tax xale bi du dee mun a def lu mu war a def parce que comme ni ñu ko waxee ci soose doomi aadama comme ni ñu ko dee waxee rek xel
yuur bi moo ko yor
waaw yuur bi moo ko yor yóor bi mooy tax nga dox yóor bi mooy tax nga xalaat yóor bi mooy tax nga wax loolu moo tax tey boo gisee nit am stroke waaye gémmiñ bang fa waaye du wax
mënut a wax
parce que place bu nga xam ne moom mooy commande gémmiñ bi pour mu wax si yóor bi la nekk so xalaat boobu rek nga war a mun a xam pour nga mun a understand ne yóor bi bu demee ba yaaxu kon yaaxu na loolu moo tax xale yooyu noonu boo leen gisee même bu fekkee ne demoon nañ ba mun a toog seen boppa ñu am feebar bi bu ñuy wax hydrocephalus rek da ngay gis ne duñ mun a toog seen boppa duñ mun a jàppa sa seen baat duñ mun a def dara seen boppa parce que lan la yuur bi dem na bi yaaxu so lu ñuy wax nit ñi rek moo nekk ne dafa simple léegi because bu njëkk ba amul ñoon ñu ko dee faj waaye léegi faj bi am na fii Gambia ok ku nga xam ne daal gis nga sa doom mbaate sa jërbaat mbaate keneen ku nga xam ne am na lii yónni leen si lopitaan yi rek parce que bu ñu demee si lopitaan yi dinañ leen woon yoon bi te bu ñu leen wonee yoon bi mun nañoo am seen faj lu si gën a solo ci feebari hydrocephalus mooy nga teel koo opéré waaw boo ko teelee opéré fekk ne yuur bi yëpp yàquwut da ngay gis ne loolu dafay jox chance yuur bi pour mu del siwaat waaye nag boo xaalee nag ba affaire yi dem ba ëppa even bu fekkee opéré nañ ko tane bu ñooy gis ci moom ak ku nga xam ne moom dafa teel a ñëw ku teel a ñëw mooy gën a am tane boo xam ne boobu lañ séntu ci moom.
Jërëjëf. Thank you so much, Dr. Jabang. Very, very clear explanation. Learning a lot myself from this. What we want to do is we're going to open the lines. It's already halfway through, 5050505, while we continue the discussion. Yes, Dr. Jabang, so you've mentioned to us one that can happen in children on the brain. Can we talk about children and other parts of the central nervous system as well?
Okay. So we will move now to the spine. And again with children, there is a condition we call Spina Bifida. Spina Bifida basically, it's an abnormality. It's a congenital abnormality. And it's a birth defect. It therefore means that during the formation of a child in the womb, there are some deficits that have resulted into a defect. And that defect, usually we see it on the back, on the lower back. I think probably if there's a picture on it, probably we will see it.
So maybe that's the next set of pictures, not the other picture with the problem in the back.
Right.
Yes.
So Spina Bifida is a complex condition, because it is formed, the defect actually happens. So that's the defect you were seeing like that in this child on the back. Now this defect is located at a very strategic area. And the area is basically where the nerves pass through. And when this defect happens, then you have the nerves themselves would now, in some cases, be involved in the defect. So a child is usually born with a swelling on the back. Sometimes the back could be just close to the neck, sometimes it is way on the thoracic back, sometimes it's just way down on the back. What happens is that depending on the type, we classify them into various types. But just for the purpose of understanding, there are two types that we know. There is the severe type, and there is one that is not severe. In the one that is not severe, the nerves are not affected. It's just a swelling of cerebrospinal fluid. Those patients or those children, they move their legs normally, they go to toilet normally, they pee normally. That's okay. All they have is a swelling at the back. That is operated and it's closed. Those kids don't have a problem. But most of the cases, unfortunately, fall in the severe part. And the severe part, the nerves are involved. The nerves are damaged. And those kids have problems with their legs, not able to walk because the nerves are damaged. And in addition to that, they are not able to control their urine, they are not able to control their stool. Those kids would also need a closure surgery, because if you don't close it, it bursts. And if it bursts, it gets an infection, and the result is not good. What is the most important message with regards to Spina Bifida and everyone that is listening to this very program? It is advised that, or let me say it this way, when Spina Bifida was, it has been with man for, let's say, as far back as possible. When they started doing research and all that, so in the West, there was a time that they did a research and they gave women of childbearing age what we call folic acid, folate. When that was given, they realized that in the group that it was given, it was less by more than half.
Yes, if we can just pause there. It seems we have a caller. As we said, we're going to just take our callers first. Yes, caller, hello.
Hello, assalamu alaikum.
Wa alaikum assalam wa rahmatullah.
Yo, mbal kontaan la programme o diata baki.
Alhamdulillah.
Nkal jube baki le wati.
Abaraka.
Nin programme o nyin kumata baki min membe jara rola karola membe ko fasol la karola te. Nte ma sasa doso ka abulo. Na ka abulo wulindi te.
Ha.
Aka batan di bake bare baral ko al be nyi jara kan ko men Gambia ja.
Ha.
Di mel la sakal je. Mari nyanta kal je no nyadi.
Okay.
Okay, I think you understood what she has said. Yes, so maybe you can. She's still.
Mbela kumo jabilale ite ila mo ila tele la dorong sa mbe doctor nyenin kakanne so ila kumo jabiro be futale la insha Allah.
Yo, la baraka bake.
Okay, baraka bake.
Okay. Okay. Baraka bake. So I'll
Yeah, you'll come back to this, but you can go on to
right. So I was talking about the spina. So they realized that those that have taken folic acid really it reduced it, and of course later research showed that part of it is really folic acid deficiency. And now what has happened in the world is that every woman of childbearing age, you are advised to take supplements of folic acid. Again, the scientific world became obviously much, let's say, wiser than that. And they said, oh, before taking a medication, every now and then you are taking medication, you forget, let's put folic acid in the food. And now people have moved from folic acid supplementation to folic acid fortification. And they will take a certain food, and they just make sure that it has folic acid. So I know that in Africa it's an issue, but in South Africa, they've been able to fortify one of the staple foods over there. So basically in the Gambia, it's just like saying that you want to fortify rice. And once you fortify rice, you've got the problem almost over.
Yes. I think the same thing we do with salt. I think we have iodine in our salt now, which has, yes.
Exactly. So that we want to tell every woman of childbearing age, the folic acid is good. There are other interesting studies that are coming on. The last time we had a meeting in Congo, and a team from Zimbabwe, the Zimbabwean team, and I think Niger, they talked about what is this thing again? Nevedai, yes?
Okay, yes.
So, and we were told that it has a high content of folic acid, and that they are currently doing a research on it. And I was like, I know when I was young, I eat a lot of nebedai, but now if you cook nebedai for somebody, it's like,
yeah.
But so I hope probably one day such a thing would happen. But coming back to the point, spina bifida, because it's a very, very difficult condition to manage, especially when they come with that, they will need Dr. Jar, they will need the urologist to be checking them every now and then because they have urinary problems, and these are lifelong conditions. Yes. They will need the orthopedics to help them on their legs. These are lifelong conditions. To prevent it is basically the best.
Of course.
Yes.
Of course. Yes. Thank you so much. I think there is a picture also that for those people who have been given surgery. Yes. So this was somebody that you operated on and removed the same one that has the lump. Yeah. Must be very complicated surgery. But it seems we have another caller in. Hello.
Yeah,
caller.
Good evening. How are you?
Good evening. Fine.
Yeah, I was just asking whether I don't know how it's called, that big head thing that they're saying.
The hydrocephalus.
Is it during pregnancy, or like if it's during pregnancy, what can one avoid such that the child will not, have such kind of a sickness also? That's what I'm asking.
Okay. Yeah.
Thank you. Yeah.
Thank you so much for that question. I mean, that's a very good question. The thing about hydrocephalus is it's difficult to say what to avoid and what not to avoid, because the causes are many, even in utero. There are few cases that show some genetic issues, very, very few. Some of them are obviously infections that people would have, but some of them just come like that, and we can't really give any explanation to it. But one thing we do also know is that those that are born a bit premature have a tendency of having bleeds in their brain, and when they have bleeds, that can block the passage. Yes, and that can result obviously into hydrocephalus. So the question is good, but the answers may not be that like something is there that you need to do to really avoid it. Infections, if you can, as much as possible, yes. But most of the others, basically, it just happens.
So yes. Can I say that maybe the best thing is to detect it early. So have your normal, make sure that you're having your antenatal care.
That's right.
During the antenatal care, if you have a good ultrasonographer, he may be able to detect it.
That's right.
And then you can have your treatment as soon as the child is born.
Of course.
Yes. So
I think just to add to that, we have been called on a number of times. With when they do
if you can just pause there, we have another caller, then you can go on to that. Hello, caller. Hello. Hello.
Hello, alba Kairat.
Kairat.
Tanante.
Yo lata ino kala sendo la kono dimu. Kono dimu do la kamuta so komsa ikono sandote.
Okay. So, Nying program, I think it's better to explain to her that this program is not about Konodimo. So maybe we can have another time to answer that question, because I really want Dr. Jabang. Having him here is very difficult.
Hello.
So,
she's
gone. Okay. So she's gone. So sorry, we are just begging our listeners, maybe we'll say it in both languages or in all the languages, that let us stick to the topic, because really having an expert like this on the studio talking about this, we will not want to dilute it by talking about other things. So let us stick to the topic. Mbokk yi ñu jéem rek lu ñoo waxtaanee tey ñu waxtaanee ko parce que gan bu mel ni Dr. Jabang nga xam ne mu ngi busy liggéeyam, bàyyi na liggéeyam yëpp ñëw fii pour waxtaanee lu mu dee liggéey ñu laajte rek laajte yoo xam ne si lu ñoo waxtaanee si la nekk. foog naa ne ñu jéem loolu noonu pour ñu mun a programme bi mun a dem kanam.
Ok, mbaɗigol mbal hakkadani la pour bi naka chamo minti nga kata nga nyinin karoke wo karola ba bi nga docteur min soto jang abe jarar fanna minna ni nga kata nga nyinin karoke wo fanna la abe kacha gana fanundi lale adabe wato fana sutiyandi lale.
Thank you. Okay. So yes, Dr. Jabang, you were talking about the I think you've spoken about it in English, so maybe we'll go into it in Wolof if that is okay. Mbokk yi Dr. Jabang léegi rek la waxtaanee beneen feebar boo xam ne dafay dal xale yi dañ ko dee judduwaale nga xam ne loolu noonu nekkul ci yuur bi waaye ci beneen place bi nekk. foog naa ne boobu nañ ko bàyyee moom mu waxtaanee ko nga xam ne moom lu mu cee wax yëpp lu mu bëgg a wax la.
waaw jërëjëf docteur Dia. ñaareel feebar bu ñooy waxtaan tey moo nekk lu ñooy wax Spina Bifida. ñaari feebar yëpp wax naa ne amuñ turi si wolof amuñ turi si soose amuñ seen tur waaye Spina Bifida rek moo nekk lan moo nekk feebar boo xam ne xale yi dañ ko dee judduwaale buñ demee ba xale bi ñëw nga gis dafay am benn jaaru nañ wax swelling néewi boo xam ne waaw dafay nekk si digg gannaaw gi waaw te néewi boobu nag feebar boo xam ne la dafa bëri problème dafa bëri problème parce que feebar bi dafa am ñaari fan.
Yes. Dr. Jabang, I'm sorry, again a caller. We'll give priority to our callers. Hello, caller.
Hello, good evening.
Good evening.
Hello, good evening.
Good evening.
Good evening. We can hear you. If you can listen to your phone, then it's easier than listening to the TV.
Okay. We are really enjoying your program. We're learning a lot from it.
Thank you.
Yes, go ahead. Do you have a question for our expert today?
Yeah, I don't have a question. I just have observation. I don't know whether I would call it an observation or a suggestion. I had a brother who was operated on some months ago at the RVTH. He had brain tumor. But he was operated on. For us, we thought that everything was okay, and he was discharged. He went home. So after some time, we saw some problems again. So he was progressing, but after some weeks, it became worse. So we could not get to the doctor who operated him. So it was very difficult for the family. His condition was just deteriorating. So at a point, we tried to get some money and then took him to Senegal. So when we went, the doctors told us that the operation was not yet completed. So those doctors, in fact, communicated to the doctor that operated on him in Gambia here. So the doctor told them that the operation was not completed. But we really felt so bad because we felt that doctor should have communicated to us since at the initial stage, told us that if this operation is not yet completed, we will still need to do some more operation. But we didn't know about it. We could not get to the doctor. Anytime we go to the hospital, it was only the nurses that we are going to attend to that patient. So unfortunately for us, we lost him. So he was there for about a week in Dakar, but he could not make it. So the family really felt bad because I don't know, maybe it's lack of communication too, because we are not experts. You are the expert. So I think if any patient comes to the hospital, you need to communicate with the family so that we know how things are going, rather than just sitting down there. We will not know, because maybe the doctor too had some other urgent issues to handle, but we do not know because we are not communicated to. So communication is what is more important to me. So I just
Thank you very much, and thank you for coming here to discuss this. I think I do encourage a lot of these things because definitely we are not perfect, but sometimes what can be seen as something that has not been done, sometimes it is not that, it is just a lack of communication. I will not be able to say much about it, but Dr. Jabang may have a little bit more information about it and may be able to help us with some answers on that. Yes.
So coming back to the question, there's always communication. Sometimes I think the problem may be some form of understanding.
Yes.
And sometimes we try to communicate to people and tell them exactly. Again, as professionals, this is a case that is in my mind that I know very well. May not be very nice to start talking about it and what you did and all that, but I would say that to them, well, our hearts go out to them for the loss. There was obviously a communication with somebody from the family, and it is not even the first time that it had happened. So I had some time to discuss with somebody in the family to even try to explain to them what the rationale was and what we were waiting for. And of course, like you said, at some point in time, they tried to get me. Of course, they couldn't. A lot of issues that came on. I was not even in the hospital at that time. And when they went to Dakar, I had the images. We had a discussion. We had a discussion with that. But like people would say, oh, a surgery was done. It is not complete. It's not every surgery that's complete. And we do know that. And that was communicated to obviously somebody. And let me just say it that way. So when you operate brain tumors, you operate them. There is what you call gross total resection. The gross total resection of a brain tumor is to remove the whole tumor. But even that does not mean that that tumor would not come back, especially in a case that it is a malignant tumor that we are talking about. So some of those things do happen. But again, we want to express our condolence to the family for all that have happened, and we would want to say that this very case, it is good for us to see the family.
Yes.
And probably, since you are listening, madam, they need to come for us to see because of certain underlying reasons that we have seen, and we spoke to the brother. If you get the brother who was always speaking with me, he would tell you. And it will be good for us to see because there were certain things that we had told him. And I think those things, it's not ethical to have a discussion like this TV, and then actually say it.
Definitely.
But our sympathy goes to the family. And to also say that, well, the department is a loaner, a loaner department.
Yes.
And you have to basically address a whole number of people.
Yes.
In addition to that, there are also other responsibilities that you have. And those responsibilities must also be met. And like you said, I agree with you in your monologue, we are not perfect. Yes. And so wherever we have gone wrong to that family, we want to say we are sorry. We are not perfect, but we look forward to getting much better.
Dr. Jabang, yes. This is very interesting. I think this will take maybe probably the rest of our time, and I am just begging you that we will have you another time, because I know getting you, the responsibilities are so much. But I think it is very important for us to, this is the reason for this program, is to bring out these things and talk about these things, because a lot of these things is a lot of misconceptions about what medicine is all about. You have said it here, a cancer is a cancer. And any cancer, you know, every doctor deals with some form of cancer. I deal with cancers, you deal with cancers of the brain. Even yours are much more difficult than mine, because they are in a very closed environment in the brain, and every part of the brain is very important. And whenever, even in the whole world, whenever you remove a cancer, you remove only the visible part of the cancer. And this cancer spreads through the blood vessels, through the lymphs, through everything, and sometimes you cannot see what has spread. So what you do is you just remove what you can remove, and then a number of them will come back again. Anywhere in the world. And you will need some additional treatment to treat that. That is number one. The second thing that people should know is we have a big challenge in the Gambia here. A big challenge in the sense that you don't have only one member of the family that takes responsibility, that you as a doctor or as a health professional you are with. And I have that problem, Dr. Jabang, also. It's not only you or anybody else. It's not only this case that where this problem is. The family comes, I explain everything to them. And then the member of family that you explain to did not explain it to the other ones that are there. So the other ones feel that they don't know what is going on. Yes, we have only one more minute to go. It is a very difficult, but I promise our viewers, this is one thing that we are going to talk about. We've talked about it before, which is the doctor-patient relationship. And that's a very important thing. But there are challenges in the country that we have. Another thing that I want to just mention in this remaining 1 minute is that when you're dealing with cancer in other countries, you as a doctor alone don't deal with it. You have a nurse counselor who does the counseling, because they have time to do the counseling and so forth. There are so many things, Madam, and just like Dr. Jabang has said, we are sorry for the loss, and we always learn from some of these things, and we will learn to do it better the next time, and we hope that the family will understand some of these nitty-gritties, but we will come back to it. We will just give you time to say your final words for today, and promise us that next week we are going to have you again, so that we can continue this discussion and the rest of the discussions.
All right.
Thank you so much, Dr. Jabang.
Thank you so much. So coming back again, so today we've talked about two conditions, right? We've talked about hydrocephalus, that is when you have the kids with the big heads, and we are saying that it is treated. Okay.
I think our time is totally up now. We just a quick maybe 10 seconds so that we can go to the news, because this one goes from here, it is the news.
That's right. Okay, so anyway, hydrocephalus and spina bifida. And I want to take time to say thank you for this invitation. And I hope that time will permit me, obviously, to come back again and complete the rest.
This talk. Thank you very much, Dr. Jabang. Thank you very much, viewers. Jërëjëf jëf ci déglu bi, dinañ leen bàyyi ba beneen yoon.
Allah baraka baake mbaɗigol fo waati ko teke inshallah.
Thank you.